Let's examine you here. I was looking at your x-rays and you are improving. Let's see, we're gonna start at the neck and work our way down to your low back.
I'm so used to sometimes just being very uncomfortable, like in this section.
Okay,
So sometimes I'm not even sure, you know,
I see.
if there's aches because of sleep, uncomfortability.
Okay. And are you still having that chest discomfort?
In a way, yeah, but I notice a lot of stuff starts to happen, at least for the upper body in this region around here.
Okay,
Like, I could be sitting up a little bit straight, but naturally I do this.
I see it. Yes, you're slouching a bit. We need to work on your foundation more, but you are improving. I looked at
Yeah.
your first x-ray
Yeah.
compared to your most recent, and the curvature of your spine has improved. Before you had a very lordotic curvature to the low back, which is likely coming from your hip misalignment. So we're going to work on your hip, but we'll see. Let's double check. And I'm going to also double check your everything, but especially your thoracic. I see something on your x-ray around T6. That could contribute to your chest discomfort. Okay, you got a small reading right here on T3, T4, right there. Okay, small break, about 5 points. And I have this on high sensitivity right there. Let's check this area. I see something on your x-ray right here. There's something hiding.
No, yeah. I feel like it's with the chest, right?
Yes, yes. This can affect your chest. Yeah. We were taught that anything can cause anything, but there is a correlation.
I feel like there's this little spot, right? Like, if it comes from my chest, it might be coming from the right side. There's a little stuff like that I feel,
Uh-huh.
and I feel like it's like around here, connected to the chest area.
About here?
Yeah.
More to the right?
Yeah. Cause I also feel
Here?
a sense, yeah, or just slightly a little bit more to the left. A little bit more.
More to the left?
Actually, it's, yeah, I think it's like a kind of actually a little bit more to the right, right there. There's like some weird, and then it also has to do with the chest.
Okay. So this is close to T6. Okay, this is the rib of T6.
There we go.
So,
Yeah, that makes sense.
yeah, and you described that you have difficulty breathing, right?
Yeah.
So if you have a misalignment to your thoracic, it can cause difficulty breathing. So let's look closer at this. I'm going to go really slow so we don't miss any reading. Because you've improved a lot.
Completely.
So, oh, good, good. And I'm glad you feel the same. But based off the Nervoscope, your readings are much less than
Yeah.
when I first started seeing you. Yeah, there's a small break here. Yeah, right there, right here. I know you feel it on the right side, but I just mark it there because just to keep as a reference.
Doctor, back to the red room.
Right there.
Doctor, back to the red room.
Yeah. Especially, they see you different. Well, I'm like that, and this guy's helping me out, so it's like, cool. It's
You're able to do your daily activities and everything, right?
Yeah, completely.
Okay, that's good.
Way better, honestly. And I feel like, my energy could be better sometimes. Just
Find it and remove that nerve pressure. Let your body heal itself. Okay, I'm getting a reading down in the low back here. Suspect that we need to work on your foundation, your pelvis, and it may be a PIEX ilium, but we'll see. Yeah, getting a small reading here.
like around there, I feel like there's something very achy.
Okay. Yeah, I got a reading right here. Yeah. Is this tender, George?
Yeah, around there. I would go up a little bit more. It's coming like everything is right there, exactly where you.
Here, right?
Yeah.
Okay,
I feel like
PIEX.
it's like. Yeah.
Yeah. It's more tender up here on top.
Yes.
Okay, how about the bottom here?
Ooh, it feels nervy, like.
Okay. This indicates
Wow, yeah.
the EX ilium, the PIEX. Okay, I'm gonna just check your sacrum.
Yeah.
Let me know if you feel any pain or tenderness. Okay, here's L5. Okay, that feels okay. S1. Okay,
Ooh.
starting to get uncomfortable. How about S2? Hey, not bad, improving. How about S3? That's not bad at all. Yeah, 4. Good. 5. You're doing great. And then coccyx. Does that hurt, George?
No, it's just it's not hurt. It's just it's just like.
I think your coccyx might be out.
Still.
Is that painful?
It's not painful. It's nah.
Not that bad? Okay, okay.
Not that bad.
But here's the right SI joint here.
Yeah, it's like everything is coming from like right here.
Your foundation, your pelvis, because it's likely affecting your breathing as well. It can. It's all connected. This is based off the foundation principle. Okay. Now I'm going to just do one more test. Can you put your feet together, please?
Yeah.
Okay, and then just open and close both knees like a butterfly. I'm feeling for any restrictions. Okay, and then just move your left leg, please. And right leg. And left leg. Yeah, the right side feels stuck. When you move your left leg, my right hand shifts with it. So that indicates you have a restriction on the right SI joint still.
Yeah.
Yeah, PIEX. Okay, we're gonna do your right hip. 5. And then here's 6. This is where we got a reading. Yeah, that makes a lot of sense. Because you pointed right at the reading here, so it's T6. And I was looking at your x-ray and I see a misalignment there. Potential subluxation. So let me just double check. Okay, my friend, let's just get you set up. Bottom leg straight, and we're just gonna bend the top knee. Perfect. All right, and then let's just put this hand a little bit higher, like that. Perfect. Okay, and then keeping your shoulder here, can you scoot your bottom hip closer to me, like 3 inches? Good. Okay, this is a PIEX push. Right there. It's a PI3EX2. Right there. All right, my friend. When you're ready, just relax as much as you can. Stabilization hand locates the contact point. We're gonna be slightly lateral to the PSS. We want to close down that EX component. Good.
Yeah, cause I feel like I'd be walking forward, and like almost like the hip is forward, not straight.
Okay, we're going to do T6. 4, 5, 6, right there. I felt it. All right. How'd that feel?
Yeah. Feel like money right there. Thank you. Yeah, I feel like more, like at least more open. That was a good conk. And I feel weight. Right now, that one right there really like, ooh.